Hello, I am Dr. Mirela Cerneanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener. The title of today's episode is Revitalizing the Body with Hormone Pellets. Fact or fiction? I am going to pick up exactly where I left off in the last episode, when I finished talking about the transdermal products used as hormone replacement therapy in the United States, mainly patches, gels, daily creams, and a little bit about progesterone. The only one left to talk about is injectable therapies. Well, first of all, what can I tell you about injectable therapy? There is no injectable estrogen therapy used as hormone replacement therapy. We do have some injectable estrogen, primarily more precisely, that we can use in an acute situation to stop a hemorrhage that is mainly in a hospital setting. It really has no place to be used in an outpatient setting, and we rarely do that anyway. There's also injectable progesterone, but that's mainly administered and used in fertility treatments, not for menopause. And then there's injectable testosterone. Most recently, a lot of providers, doctors, and clinics are using injectable testosterone for women. First of all, if you remember the discussion I had at the beginning of the podcast about bioidentical and non-bioidentical, remember two things you need to know about testosterone replacement injections for women. Number one, the testosterone administered via the injection is not bioidentical. Number two, it is actually testosterone cypionate or propionate. Number two, there is no approved dose by an entity or by the FDA that's been studied, that's reliable for testosterone injectable use in women. The providers that use injectable testosterone are using formulations for males that are compounded by a compounding pharmacy, which will need to use a vial that comes in 100 milligrams or 200 milligrams, and will have to compound it to a much lower dose, to somewhere between 2 to 10 milligrams of a dose to be administered either weekly or twice a week. So I'd like to talk a little bit about the injected testosterone. What is interesting about the injected testosterone, it's more bioavailable. As soon as it's released, it will be bioavailable and circulating 24/7, but only for a few days. And one of the things that happens with any injections is when they're administered, you literally get hit with the hammer and you get that hormone bomb that explodes all over your body and your tissues get flooded. So I'll come back to that in a little bit. So not my favorite because of that reason. And this brings us to the topic of the podcast, pellet therapy. What are these pellets? First of all, pellets are very small, particulated, compounded, bioidentical hormones synthesized from Mexican yams. And they literally look like a small, wide bead. There are few pharmacies in the United States that compound pellets well. Most compounding pharmacies do not compound hormone pellets. They have to be regulated and approved for making and synthesizing hormone pellets. How are the pellets different? Well, first of all, they have to be inserted in the body. And that comes in the form of a procedure, which is literally a small injection. But I'm going to describe it for you if you've never heard of it. In the process of this insertion, we use a large needle. It's called a trocar. That's about 4 millimeters in diameter. So if you think about it, it's pretty big. This needle is hollow and it's introduced into the body after a small incision with the scalpel. And it's used first with the help of an introducer that's pointy at the top to allow threading it through the tissues. And then the introducer is removed, the pellets are loaded into the trocar, placed into the hollow trocar and pushed in with the help of a blunt introducer. and delivered about 2 inches from the tiny incision that was made into the skin. So they land within the subcutaneous fat tissue, and it depends on the skill of the doctor and the amount of fat tissue in the area and whether or not there's scar tissue from a previous pellet. If you think it sounds painful, think again. It's not painful at all. This procedure is done using local anesthesia with lidocaine, which is injected before the small incision is made, so you don't feel anything. Most patients feel the anesthesia like a small bee sting, and it lasts a few seconds. Then they don't feel anything at all, and the area is pretty numb for a few hours afterwards. So why is this method different, and why would it be better or worse? Well, for starters, these pellets are biodegradable. So the way they work, the body will literally eat them up, just like it does with sutures that are placed at the time of surgery and are biodegradable. The body will melt them down, will disintegrate them on its own. And we actually bank on that effect. We hope that that's going to happen. You also need to know that compounded pellets were first described in 1950 as a treatment to address menopausal symptoms. They've been around for a very, very long time. They are not new. It's not something that just came on the market. It's just there are not that many doctors trained in administering them or using them properly. The subcutaneous administration of testosterone has been used worldwide for many decades. Many practitioners and patients have found this route of administration to provide safe and effective therapy without the fluctuations in blood levels that are seen, and we just talked about them in a previous podcast, with the transdermal estrogen testosterone or the intramuscular testosterone. The pellets usually last anywhere from 2.5 to maybe 4, maximum 6 months. So what happens to the hormone levels that are being released by the pellets? How is the bioavailability of the pellets different than all the other methods? And here is the key. The bioavailability of testosterone and estrogen by subcutaneous implant by pellet is virtually 100%, which is according to the Wikipedia entry of the pharmacokinetics of testosterone. It is a well-known fact that the bioavailability of drugs that are administered intramuscularly is generally 95%. So clearly injectable hormones are more bioavailable, much more significantly so than any other application. And this is true for all of them, but specifically for estrogen and testosterone. The key issue with pellet bioavailability is also that releasing hormones into the circulation is actually based on your heart rate. To make it simple, let me use the analogy of licking a lollipop. There are people who can eat the lollipop in a minute, and there are people who take 30 minutes for the same lollipop. There will be a significant variability in how people release hormone levels from the pellet from one person to the other. However, once you've had 2 or 3 pellet insertions, your hormone levels, the dosing, the symptoms are all going to be assessed and evaluated by hopefully what is an experienced pellet doctor. And then it will pretty much stay the same throughout the rest of the time you decide to use pellet therapy. But it could be a little choppy at the beginning because we have no idea how the pellet will be released from your body. It takes us a few insertions to understand that. So think about it this way. Everything else in the body that we introduce in the form of an oral tablet, a transdermal cream, a transdermal gel, a patch, relies on the rate of ingestion, absorption, diffusion across the skin, etc. It has no internal regulatory mechanism that allows these hormones to be released. But that is what you get with the pellet. Your heart rate, it's the internal regulator of how hormones are being released. There's lots of discussion and there's lots of hormone replacement therapy providers, doctors, naturopathic providers, who keep discussing and mentioning that the levels that you get from pellet therapy are erratic. That is not true. Of all the methods that I have used, the most reliable for the body and the one that provides the best bioavailability is pellet therapy. The concept of using pellet therapy is similar to using the insulin pump. It's no different. I have said before that a daily administration of any hormone or medication will be subject to releasing a significant peak or being exposed to a super high level of hormone for 1 to 2 hours, after which this high level, which has been absorbed by the most sensitive and ready to receive tissues and organs, there's nothing left to sustain these levels or to continue to nourish the cells, the organs, and the tissues. Your levels will continue to decline until you administer the next dose. You need to keep applying more hormone, orally or transdermally. And if we're talking about erratic levels, I just want to mention here again, testosterone injections release a significantly supraphysiologic peak within 24 to 48 hours that gradually declines over the next 5 to 10 days until time comes for a woman to get another shot. From a physiologic standpoint, it does not make sense. It creates this phenomenon where you literally hormone bombed. Yes, it's like a testosterone bomb explodes in your body. It might actually feel pretty great. I personally don't know because I've never tried a testosterone shot, but clients report significantly improved energy, better mood, feeling strong, greater capacity to perform exercise and to recover post-exercise, as well as greatly improved insight, mental clarity, and ability to make decisions on the fly. These are all things that come with that testosterone euphoric, high peak supraphysiologic administration. So some women love it and they prefer it. How are pellet hormone levels different from the daily cream or the weekly injections? Well, you should know that the pellet hormone levels are actually subject to a gradual rise at the beginning, which could last 1 to 2 weeks until they achieve steady state level. And you should also know that at the end of the pellet, it's not an abrupt drop. There is a gradual decline, which can usually take a few weeks to a few months. But the beautiful thing about the pellet is that for 2.5 to 3 months, your levels are nice and steady, and nothing else on the market for hormone replacement will give you that. And again, the pellets are biodegradable, which means they don't have to be removed. Your body gets them burnt up at a rate depending on the dose of hormone, the capability of your immune system to break it down, and your heart rate. So are the hormone levels generated by the pellet therapy reliably identical and consistently in the same range from one client to the next? No. They will vary widely. The same dose of pellet will manifest and be processed completely different from client to client. Because not only is the pellet dosing in need of being customized, but remember, the rate of breakdown of the pellet and the rate of release of hormone from that pellet will differ from one client to another. And you will hear that as being the main criticism of the anti-pellet naysayers. In reality, the inconsistency of blood levels, it's true for the patch, it's true for the pill, again, because the rate of diffusion from the patch is highly variable from one person to the next. And the rate of absorption of oral estrogen is highly different from one woman to another. One other thing to know about pellet therapy, it can linger many months after. So we advise all clients that they need to continue monitoring their levels, and support with progesterone from a year from their last pellet is a must. I've had patients who get 1 pellet, 2 pellets, and then something happens. Things happen in their life. They move out of the area. They have to travel for a long period of time. They get distracted. They don't realize when their last pellet insertion was. And suddenly they're like, oh my God, I feel as bad as I did before the pellet. What happened? And now a year has gone by. I sometimes have patients that live in the United States and part of the time they live outside of the United States. So they time their pellet insertions with their travel. But occasionally they go 6 to 12 months between insertions and they do just fine. They're very happy with the results. Of course, by the time they come back for another insertion, their levels are low and they have started getting a little bit of symptoms. But what is interesting about the pellet, it's nothing like the acute serious deficiency symptoms that you get once you've been off creams or off patches for just a few weeks. It's a very slow letdown. Now, a major disadvantage of estradiol and testosterone pellet implants is that they cannot be easily removed. As a matter of fact, they're not visible on X-ray And unless you can palpate them under the skin, they will not be able to be removed should this be necessary in an extremely rare situation. A major advantage of estradiol and testosterone pellet implants is convenience and guaranteed compliance. They clearly do not have the issues pertaining to the first pass metabolism, as they don't go through the liver, but there is some concern about accumulation of specifically estradiol levels with long-term repeated pellet implantation, and that's something that has to be watched. Estradiol levels may remain above baseline for a year or in some cases a few years following the last pellet insertion. And I see that occasionally with women. And interestingly enough, those are women who have been estrogen dominant for the majority of their life, who perhaps had a hysterectomy for fibroid removal, who had a history of an ablation for severe heavy periods. These are clearly women that already are prone and predisposed to have issues eliminating and getting rid of the estrogen. So these are the women to watch for. As a side note, an estradiol or testosterone implant pellet has not been approved by the FDA as a pharmaceutical medication in the United States. But hormone pellet implants, including estradiol pellets and testosterone pellets, are available as custom compounded products in the United States. Estradiol pellet implants are advantageous in the fact that some women seem to need the higher levels of estradiol for adequate relief of menopausal symptoms and the specific situation of sometimes adrenal fatigue to help them pull out of adrenal fatigue. And subcutaneous estradiol pellets are easily able to achieve such levels. This is not necessarily the case with oral or transdermal estradiol creams or patches. Some women find the pellet therapy to be painful, and sometimes the body can react to the presence of the hormone implants and create an inflammatory reaction around the pellet, which is felt like a nodule or a small bump. Sometimes this bump persists for weeks or even months. Occasionally, if a client has experienced multiple insertions in the same area, scar tissue can develop, and inserting the trocar with the pressure required to overcome the scar tissue can inadvertently rarely damage surrounding healthy tissue or a blood vessel, creating a hematoma. Applying an ice pack regularly for a few days immediately after the insertion, especially if it's super painful and unusually painful compared to previous insertions, usually prevents that from expanding and resolves the situation. There's also the risk of infection, and even though that's extremely rare, it's a possibility that does not exist with any other method out there because there's no risk of infection with the patch, the gel, or the cream. Keep in mind another downside is that most insurance plans do not reimburse for hormone replacement therapy. They consider it experimental, therefore it's often denied. So the responsibility for payment falls on the shoulders of the client desiring such a therapy. And because of this reason, many doctors who practice pellet therapy are also cash-only physicians and cash-only providers, so they don't even offer billing as an option. As I mentioned in an earlier podcast, I have personally never tried the patches for the pure reason of not wishing to expose myself to the adhesive presence on my skin 24 hours a day, 7 days a week. Plus, I did not want to use a daily cream as it wasn't convenient at all. I would forget to apply it on a regular basis, rendering it useless. So after 2 years of fiddling with my hormones, I finally decided to use pellet therapy. I have used it for 5 years. I absolutely love it. I find it very convenient and it works very well for me. I check my hormones on a regular basis. I keep an eye on them. I don't have any side effects. I take progesterone regularly by mouth, and I have a normal light period 3 to 4 days a month. I hope you learned something useful. This is my last podcast in the Hormone Replacement Podcast series, and I sincerely hope I shed some light into the maze of the tunnels that is the hormone replacement therapy for you, and you are empowered to make the best choice for you. I wish you good luck in your quest for the best hormone replacement therapy option. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.